There is a new kind of weight loss conversation happening in America. It is not about a celebrity diet. It is not about cutting out bread. It is not about drinking lemon water every morning. It is about medicines. Names like Ozempic, Wegovy, Mounjaro, and Zepbound have become some of the most talked about drug names in the United States. They are discussed in doctors' offices, on podcasts, in family conversations, on social media, in gyms, in pharmacies, and even around dinner tables. Some people call them miracle drugs. Some people call them dangerous shortcuts. Some people say they finally help them control hunger after years of struggle. Others say they cause side effects they were not prepared for. And many people are asking one simple question: what is really happening inside the body? When a medicine becomes this famous, it is easy for the truth to get lost. One person says, it melts fat. Another person says, it shuts down your stomach. Someone else says it is only for diabetes, and another says everyone should take it. But the real story is more interesting and much more important. These medicines are not magic. They are not fake either. They are powerful medical tools that work through one of the most important systems in the human body: the hunger, fullness, digestion, and metabolism system. To understand why America is searching for them so much, we need to understand something deeper. Weight loss is not just about willpower. It is not just about telling someone to eat less. It is not just about motivation. The human body has hormones, brain signals, digestion signals, blood sugar signals, stress signals, sleep signals, and reward signals that all affect appetite. That is why two people can eat similar meals and have very different hunger patterns. One person may stop eating after a small plate, while another person may still feel hungry. One person may feel satisfied for hours, while another person may think about food again very quickly. Some people can lose weight, but then feel intense hunger as the body tries to regain it. This is one reason these new medicines became so powerful in the conversation. They do not simply tell people to try harder. They change biological signals that make trying harder feel almost impossible for some people. But there is also a second side to the story. Any medicine powerful enough to change appetite, digestion, blood sugar, and body weight is also powerful enough to cause side effects. So today, let's break this down in a clear, calm, scientific way. How these drugs work, why they are so popular, what happens during the weight loss journey, what benefits and risks people should know, and why nobody should buy mystery versions online. Let's begin with the basic science. Many of these famous medicines belong to a class called GLP-1 receptor agonists. GLP-1 stands for glucagon-like peptide 1. That name sounds complicated, but the idea is actually simple. After you eat, your gut does not stay silent. Your digestive system sends messages to your brain, pancreas, stomach, and liver. It tells the body, food has arrived. It helps the pancreas release insulin when blood sugar rises. It helps reduce another hormone called glucagon when it is not needed. It slows stomach emptying, and it sends fullness signals to the brain. GLP-1 is one of the hormones involved in this process. So when scientists develop medicines that copy or enhance GLP-1 activity, they were not inventing a random trick. They were using a signal the body already understands. This is one reason these medications can feel so different from traditional diets. A diet says, eat less. A GLP-1 medicine may help the body feel, I am full sooner and I do not need as much food. That difference matters. For many people living with obesity, hunger is not just a small feeling in the stomach. It can feel like constant mental pressure. Some people call it food noise. Food noise is the repeated thought of food throughout the day. What should I eat next? Why am I still hungry? Why am I craving something sweet? Why do I feel full for only a short time? Why is it so hard to stop snacking at night? People who respond well to these medicines often say that the food noise becomes quieter. The brain is no longer shouting about food all day. A smaller meal may feel satisfying. Cravings may be easier to pause. The person may feel more control, not because their personality changed, but because the hunger signal changed. This is one of the biggest reasons these drugs became famous. They gave many people an experience they had never had before, eating less without feeling like they were fighting their body every hour. But we have to be very clear, these medicines do not melt fat directly. They do not burn calories like a furnace. They do not remove the need for nutrition, movement, sleep, or medical care. They mainly help weight loss by reducing appetite, increasing fullness, slowing digestion, and improving blood sugar-related signals. When food intake goes down over time, body weight can go down. That is the basic pathway. The medicine can make eating less feel easier, but it does not replace the bigger health picture. There are different medicines in this family. Semaglutide is the active ingredient in Ozempic and Wegovy. Ozempic is widely known as a diabetes medicine, while Wegovy is approved for chronic weight management in certain patients. Tirzepatide is the active ingredient in Mounjaro and Zepbound. Mounjaro is known for type 2 diabetes, while Zepbound is approved for chronic weight management in adults with obesity or overweight plus certain weight-related conditions. There is an important scientific difference here. Semaglutide mainly activates the GLP-1 receptor. Tirzepatide activates two hormone pathways, GLP-1 and GIP. GIP stands for glucose-dependent insulinotropic polypeptide. Like GLP-1, GIP is involved in the body's response to food. Tirzepatide is sometimes called a dual agonist because it works through both GIP and GLP-1 pathways. This dual action is one reason tirzepatide has produced major weight loss results in clinical studies. But again, this does not mean everyone should take it. It means the medicine is biologically powerful, and powerful medicines require medical supervision. Now let's talk about the weight loss journey itself. A person does not usually go from struggling with appetite one day to reaching their goal weight the next. Weight loss with these medicines usually happens gradually. In the beginning, doctors often focus on whether the person can tolerate the medicine. The body needs time to adjust. The digestive system may react. The person may feel nausea, constipation, diarrhea, bloating, reflux, or stomach discomfort. This is why medical follow-up matters from the very beginning. For some people, the early weeks feel manageable. They notice less hunger, smaller portions, and fewer cravings. For others, the early weeks are uncomfortable. They may feel too full, tired, or nauseated. Some people need more time. Some people stop because the side effects are too strong. This is not a failure. It is the reality of medicine. Every body responds differently. After the early adjustment period, many people begin to notice changes in daily eating patterns. They may no longer want large meals. They may skip unnecessary snacks. They may feel less interested in sugary or greasy foods. They may feel full after a few bites more than they expected. This is where a very important warning comes in. Just because a person can eat very little does not mean they should eat poorly. When appetite drops, nutrition becomes even more important. If someone eats too little protein, too little fiber, too few vitamins, or too few minerals, the body may lose more than fat. It may lose muscle. And muscle is not just about appearance. Muscle helps protect strength, balance, blood sugar control, movement, and independence. This is especially important for adults over 50. As people age, the body naturally becomes more vulnerable to muscle loss. If weight loss happens too quickly, without enough nutrition and strength-building activity, a person may become lighter, but weaker. That is not the goal. The goal is not simply to make the scale smaller. The goal is to improve health. A healthier weight loss journey should protect muscle, support energy, improve blood markers, reduce health risks where possible, and help the person function better in daily life. That is why doctors often remind patients that the medicine is only one part of the plan. Food quality still matters. Protein still matters. Fiber still matters. Hydration still matters. Walking still matters. Resistance exercise still matters. Sleep still matters. Regular follow-up still matters. The medicine may make these changes easier, but it does not replace them. Think of it like turning down the volume on hunger. When the volume is lower, a person may finally have enough mental space to make better choices. But the better choices still matter. Now let's look at why these medicines are booming so much in the United States. America has high rates of obesity, type 2 diabetes, heart disease, high blood pressure, sleep apnea, fatty liver disease, and other weight-related health concerns. At the same time, many people have spent years trying traditional approaches without lasting success. They lose weight, regain it, lose it again, regain it again. This cycle can be exhausting. It can feel emotionally painful. It can create shame. And it can make people believe they are weak, when in reality the body is defending its weight through strong biological systems. The brain has areas that regulate appetite and reward. The gut sends hunger and fullness signals. Fat tissue sends hormone signals. The pancreas manages insulin. The liver stores and releases energy. Muscle affects glucose use. Sleep affects hunger hormones. Stress can affect cravings. And modern food environments can make overeating easier than ever. So when a medicine comes along that helps control appetite at the hormonal level, it changes the conversation. For many people, it feels like proof that weight is not just a character issue. It is biology. That is an important shift. But it also creates a new danger. The danger is thinking biology can be solved by a single injection or pill. That is too simple. Obesity is chronic and complex. For some people, long-term medicine may be part of long-term care. For others, medicine may not be appropriate. For some, side effects may be too much. For others, cost or access may be a major barrier. And for many, the best result comes when medicine is combined with nutrition, movement, sleep, and mental health support. Now let's talk about results. Clinical trials of semaglutide and tirzepatide have shown significant average weight loss in adults with obesity or overweight. In major studies, semaglutide helped many participants lose meaningful weight when combined with lifestyle intervention. Tirzepatide also showed large average weight reductions in clinical trials. But averages can be misleading. When a study says the average person lost a certain percentage of body weight, that does not mean every person lost that amount. Some people lose more, some lose less. Some stop early because of side effects. Some do not respond as strongly. Some regain weight after stopping. This is why it is dangerous to hear one person's dramatic story online and assume it will happen to everyone. A viral before and after photo is not a medical plan. A celebrity interview is not a prescription. A friend's success is not proof that the same drug is safe for you. The body is personal. Medical history matters. Current medications matter. Age matters. Digestive history matters. Pregnancy plans matter. Diabetes status matters. Gallbladder history matters. Kidney function matters. Eating patterns matter. Mental health matters. This is why proper medical evaluation is not optional. It is part of safety. One of the most important questions people ask is, what are the side effects? The most common side effects are digestive. Nausea is one of the big ones. Vomiting can happen. Diarrhea can happen. Constipation can happen. Stomach pain can happen. Bloating, burping, reflux, and discomfort can happen. Some people feel fatigue. Some report headaches. Some report hair shedding, which may happen during significant weight loss for different reasons, including stress on the body or nutrition changes. Many of these effects are connected to the same mechanisms that help the medicine work. If digestion slows, a person may feel full longer. But slower digestion can also create nausea, heaviness, reflux, or constipation. If appetite drops, a person may eat less. But eating much less may also lead to low energy, dehydration, or poor nutrient intake if not managed carefully. So the benefit and the side effect can come from the same pathway. That is why people should not treat these drugs like simple beauty products. They affect real physiology. There are also less common but more serious concerns. Some people may develop gallbladder problems. Rapid weight loss itself can increase gallstone risk. Some may have severe gastrointestinal symptoms. People with certain digestive conditions may need special caution. There have been concerns about pancreatitis, which is inflammation of the pancreas. People with diabetes who also use insulin or certain other diabetes medicines may have a higher risk of low blood sugar if treatment is not carefully managed. There are also warnings related to thyroid C-cell tumours based on animal studies, and these medicines may not be appropriate for people with certain personal or family histories, such as medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. This is not meant to scare people. It is meant to be honest. Every medicine has risks. The question is not, is there any risk? The question is, for this specific person, do the likely benefits outweigh the risks, and is there a safe monitoring plan? That is a doctor's job. Now let's address one of the biggest online misunderstandings. People often say, just take the shot and lose weight. That is not how responsible treatment works. A safe journey begins before the medicine. It begins with a health evaluation. Why does the person want treatment? What is their weight-related health risk? Do they have type 2 diabetes? Do they have high blood pressure? Do they have sleep apnea? Do they have high cholesterol? Do they have heart disease? Do they have a history of pancreatitis or gallbladder disease? Do they have severe reflux or delayed stomach emptying? Are they pregnant or planning pregnancy? Are they taking other medicines that may interact with appetite or blood sugar? Do they have a history of disordered eating? Can they access follow-up care? Can they maintain nutrition while appetite is reduced? These questions matter because the goal is not just weight loss. The goal is safe, sustainable health improvement. Now let's talk about the emotional side. For many people, weight is not just a number. It is tied to years of judgment. Doctor visits where they felt blamed, family comments, clothing struggles, diet failures, hunger that felt embarrassing, regain that felt like defeat. So when a medicine finally quiets hunger, people may feel relief. Some say, is this how other people feel around food? That sentence is powerful. It shows that appetite is not equal for everyone. Some people have a much louder internal hunger signal. Some people have stronger cravings. Some have more reward response to food. Some have medical conditions or medications that increase weight. Some gained weight after pregnancy, stress, injury, illness, or aging. So when these medicines work, they can reduce shame. They can help people understand that their body was not broken because they lack character. Their biology was fighting them. That is a compassionate message. But there is also a cultural problem. The popularity of these drugs can make thinness feel even more pressured. Some people who do not medically need weight loss treatment may want it for appearance alone. Some may want to become smaller quickly. Some may ignore warning signs. Some may undereat. Some may compare themselves to celebrities. That is not health. That is pressure. A medically responsible message must say this clearly. The goal should not be extreme thinness. The goal should be better health, better function, better metabolic markers, better energy, and a body that can live well. Weight loss medicine should not become another tool for body shame. It should be used carefully for people who may truly benefit medically. Now let's discuss what happens when someone stops taking the medicine. This is one of the most important parts of the story. Many people think, I will take it for a few months, lose the weight, and then I will stop. But the body does not always work like that. When the medicine is stopped, hunger may return. Food noise may come back. The stomach may empty more normally. Appetite signals may rise. The body may push toward weight regain. This does not mean the medicine failed. It means obesity often behaves like a chronic condition. Think about high blood pressure. If someone takes blood pressure medicine and their numbers improve, we do not always say, "You are cured forever. Stop everything." Sometimes the medicine is controlling the condition. Something similar may happen with obesity treatment. For many people, long-term planning is needed. That plan may include continued medication, changing to another strategy, nutrition support, strength training, behavioral support, or close follow-up. But stopping suddenly without a plan can lead to frustration. Research following people after semaglutide withdrawal showed that participants regained a large portion of the weight they had lost over the following year. That is a very important message. These medicines may help during treatment, but the body still has systems that defend weight. Long-term weight management requires long-term thinking. Now let's talk about the difference between weight loss and fat loss. When people say they lost weight, the scale does not tell the whole story. Weight can include fat, water, muscle, glycogen, and digestive contents. The healthiest goal is usually to reduce excess fat while preserving muscle. Muscle is metabolically active. It helps the body use glucose, it supports posture, it protects joints, it helps prevent falls, it helps people climb stairs, carry groceries, and live independently. When people lose weight quickly, they may also lose muscle if they do not eat enough protein or do resistance exercise. This is why a good doctor or dietitian may ask what the person is eating, not just what the scale says. Are they getting enough protein? Are they tolerating meals? Are they constipated? Are they hydrated? Are they dizzy? Are they able to exercise? Are they losing strength? Are they feeling weak? Are they getting blood work when needed? These questions protect health. A smaller number on the scale is not worth becoming weak, malnourished, or unwell. Now let's talk about the role of food while using these medicines. The medicine may reduce appetite, but the food still becomes the building material for the body. If someone eats mostly low-nutrient foods in tiny amounts, they may lose weight, but feel terrible. If appetite is low, every meal matters more. A helpful pattern is usually balanced nutrition, enough protein, enough fiber, enough fluids, and enough micronutrients. But this should not become extreme dieting. The point is not starvation. The point is nourishment. Because when appetite is reduced, some people accidentally undereat. They may skip meals, eat only a few bites, and then feel exhausted. That is why professional guidance matters. A doctor or dietitian can help patients avoid dangerous restriction and protect the body during weight loss. Now let's talk about exercise. Exercise with GLP-1 medicines is not only about burning calories. That is an outdated way to think. Movement supports muscle, heart health, insulin sensitivity, mood, balance, and long-term weight maintenance. Walking can help. Strength training can help. Stretching and mobility can help. The most important idea is consistency and safety. For older adults, strength training is especially valuable because muscle loss becomes more common with age, but exercise should match the person's ability. A person with joint pain, heart disease, dizziness, or severe fatigue should not copy an extreme workout online. Medical guidance matters. Now let's address diabetes. Some of these medicines became famous because of type 2 diabetes treatment. GLP-1 receptor agonists can help improve blood sugar control by increasing insulin release when glucose is elevated and reducing inappropriate glucagon release. They may also reduce appetite and weight, which can improve insulin resistance for some patients. But diabetes treatment is very individual. A person using insulin or medications that increase insulin may need careful monitoring to avoid low blood sugar. This is another reason nobody should borrow these medicines or use them without a clinician. Blood sugar is not something to guess with. Now let's address heart health. Some GLP-1 medicines have shown cardiovascular benefits in certain high-risk groups. Semaglutide has evidence for reducing major cardiovascular events in adults with established cardiovascular disease and obesity or overweight. This is one reason the conversation has moved beyond appearance. These medicines are not being studied only because people want to fit into smaller clothes. They are being studied because obesity is connected to serious conditions like diabetes, heart disease, sleep apnea, fatty liver disease, high blood pressure, and mobility limitations. That does not mean every person will get every benefit. It means the medical field is looking at obesity treatment as risk reduction, not just weight reduction. This is a major change. Now let's talk about access and cost. A major reason the topic is so heavily searched is that many people want these medicines but cannot easily get them. They can be expensive. Insurance coverage may be inconsistent. Some plans cover them for diabetes but not for weight loss. Some require prior authorization. Some patients qualify medically but still cannot afford them. This creates frustration. It also creates opportunity for unsafe sellers. When a medicine is expensive and popular, the internet becomes flooded with cheaper alternatives. Some may be legitimate pharmacies working under proper medical supervision, but many are not. This is where people must be extremely careful. The FDA has warned about unapproved GLP-1 products sold online, including products falsely labelled for research purposes or not for human consumption. That is a huge red flag. If something says not for human consumption, it should not be injected or swallowed by a human. If a website promises a powerful prescription drug without real medical evaluation, that is a warning sign. If a vial arrives from an unknown source, the person may not know what is inside. The dose may be wrong. The ingredient may be different. The product may be contaminated. The instructions may be unsafe. This is not like buying a protein bar. This is a medicine that affects digestion, blood sugar, appetite, and metabolism. So here is a simple rule. Do not buy mystery GLP-1 products from social media, shady websites, or sellers who avoid proper medical care. A lower price is not worth serious harm. Now let's talk about compounded versions. During shortages, compounding became a major part of the conversation. Compounding can have a legal role in medicine under certain circumstances, but compounded drugs are not the same as FDA-approved brand products. FDA-approved drugs go through review for safety, effectiveness, quality, manufacturing, labeling, and consistency. Compounded drugs are not approved by the FDA in the same way. This does not mean every compounded product is automatically fake. But it does mean patients need to be very careful and should only work with qualified medical professionals and properly regulated pharmacies. A big problem is when companies market mass-produced copycat versions, or when sellers use salt forms or research chemicals that are not the same as the approved medicine. For viewers, the safest message is, do not self-source, do not self-mix, do not guess your dose, and do not trust online sellers just because they use familiar words like semaglutide or tirzepatide. Now let's talk about side effects in more detail. Nausea is probably the most famous one. Why does it happen? Part of the reason is slowed gastric emptying. Gastric emptying means how quickly food leaves the stomach and enters the small intestine. When this slows, food stays in the stomach longer. That can help a person feel full longer, but it can also cause nausea, pressure, burping, reflux, or vomiting. Constipation can happen because digestion slows and food intake may drop. If someone eats less fibre or drinks less fluid, constipation may get worse. Diarrhea can also happen, especially during adjustment. Some people may feel abdominal pain or cramping. Reflux can worsen in some people because the stomach feels fuller longer. Fatigue can happen if food intake drops too much, or if the body is adjusting. Hair shedding may occur during rapid weight loss or insufficient nutrition. Gallbladder issues may happen because weight loss itself can affect bile and gallstone formation. Severe, persistent abdominal pain should never be ignored. Repeated vomiting should never be ignored. Signs of dehydration should never be ignored. Symptoms of an allergic reaction should never be ignored. This is not a medicine to push through without medical advice. Now let's talk about the face and body changes people discuss online. You may have heard phrases like Ozempic face. This is not a medical diagnosis. It usually refers to facial volume changes after significant weight loss. When someone loses fat, they may lose fat from many areas, including the face. If weight loss is fast or large, the face may look more hollow or aged. This is not unique to one medicine. It can happen with any significant weight loss. The same is true for loose skin. If someone loses a large amount of weight, skin may not fully tighten, especially depending on age, genetics, amount of weight lost, and speed of weight loss. This is important because online culture often oversimplifies body changes. The medicine is not specifically attacking the face. The body is losing weight in multiple places. Again, the best approach is steady medical care, strength protection, and realistic expectations. Now let's discuss who should be extra cautious. People with a history of certain thyroid cancers or multiple endocrine neoplasia syndrome type 2 may be told not to use some of these medicines. People with a history of pancreatitis need careful evaluation. People with severe gastrointestinal disease need careful evaluation. People with gallbladder disease need careful discussion. People using diabetes medications need monitoring for blood sugar changes. People who are pregnant, trying to become pregnant, or breastfeeding need medical guidance. People with eating disorders or a history of dangerous restriction need specialized care. Teens and young people should never use these medicines casually or because of appearance pressure. For younger patients, treatment decisions must involve qualified clinicians and parents or guardians where appropriate. This is not because young people should be shamed. It is because growing bodies, mental health, nutrition, and long-term safety must be protected. Now let's talk about why the word journey matters. Weight loss medicine is not just the moment someone starts the prescription. It is a full process. Before treatment, there is evaluation. At the start, there is adjustment. During treatment, there is monitoring. As weight changes, there is nutrition planning. As appetite changes, there is behavior change. As the body adapts, there may be plateaus. As the person reaches a healthier range, there must be maintenance planning. And if treatment stops, there must be a strategy for hunger returning. This is why the best doctors do not just ask, "How much weight did you lose?" They ask, "How are you feeling? Are you able to eat enough? Are you drinking enough? Are you constipated? Are you dizzy? Are you losing strength? Are you sleeping? Are your blood markers improving? Are you having side effects? Are you building habits that will support long-term health?" That is real care. Now let's discuss plateaus. Many people lose weight faster in the beginning and slower later. This is normal. The body adapts. Energy needs change as body weight changes. Appetite may shift. Activity may shift. Fluid changes may slow. A plateau does not always mean the medicine stopped working. It may mean the body is reaching a new balance. This is another reason people should avoid panic. Online culture loves dramatic weekly changes. Real health is slower. The goal is not endless weight loss. The goal is reaching a safer, stronger, more stable body. Now let's talk about mental health. For some people, reduced food noise can improve mood and reduce distress around eating. For others, Rapid changes in appetite, body image, or eating patterns can create anxiety. Some may become overly focused on the scale. Some may fear eating. Some may feel uncomfortable with attention from others. Some may struggle when hunger returns. This is why mental health support can be important. A person is not just a metabolism. They are a human being. Weight loss can change how people see themselves and how others treat them. That can be emotionally complex. A healthy journey includes self-respect at every size, not only after weight loss. Now let's talk about the difference between medical use and vanity use. Medical use means a clinician has identified a health-related reason for treatment. This may involve obesity, overweight with weight-related conditions, diabetes, cardiovascular risk, or other approved indications. Vanity use means someone wants to lose a small amount of weight for appearance, social pressure, or comparison. That is risky. When demand is high, people who medically need the drug may struggle with access, and people using it casually may expose themselves to side effects without a strong health reason. This is especially concerning for young people and those vulnerable to body image pressure. A medicine should not become a trend simply because thinness is fashionable. That would be the wrong lesson. The better lesson is that obesity care is becoming more scientific, more compassionate, and more biologically informed. Now let's talk about what these medicines teach us about obesity. For decades, people with obesity were often told, just eat less and move more. That advice is not completely wrong, but it is incomplete. Yes, energy balance matters, calories matter, movement matters. But the body is not a simple calculator. Hunger changes, satiety changes, hormones change, stress changes, sleep changes. Medications can cause weight gain. Injuries reduce movement. Genes affect appetite. Food environments affect choice. And weight loss itself can trigger biological resistance. When people lose weight, the body may increase hunger and reduce energy expenditure. This makes regain common. That is why many experts now describe obesity as a chronic relapsing disease for many patients. This does not mean people have no responsibility. It means responsibility should be supported by science, not shame. A person with high blood pressure is not told to simply try harder forever without treatment. A person with asthma is not blamed for needing an inhaler. A person with diabetes is not considered morally weak for needing medicine. Obesity should be treated with the same seriousness and compassion. Now let's address one common criticism. Some people say, these drugs are cheating. But what does cheating mean in medicine? Is it cheating to take blood pressure medicine? Is it cheating to use insulin? Is it cheating to take antidepressants? Is it cheating to use glasses? Medicine exists because the body sometimes needs help. The better question is not whether it is cheating. The better question is whether it is safe, appropriate, monitored, and beneficial for that person. For some people, it may be a valuable treatment. For others, it may be unnecessary or unsafe. That decision should be medical, not moral. Now let's discuss another criticism. Some people say people will just gain it all back. Weight regain can happen, especially after stopping treatment. But this does not mean treatment has no value. Blood pressure can rise when medicine stops. Blood sugar can rise when diabetes treatment stops. Some chronic symptoms can return when treatment stops. Chronic conditions often require long-term management. The key is honesty. People should not be sold the fantasy of a short-term fix. They should be given a long-term plan. If the medicine is stopped, what happens next? How will hunger be managed? What habits have been built? What support is in place? What medical markers will be monitored? What is the maintenance strategy? That is how responsible care works. Now let's talk about the future. The weight loss medicine field is moving very quickly. Researchers are studying newer drugs, oral versions, combination therapies, and medicines that affect multiple hormone pathways. This is one reason the topic remains so heavily searched. People want to know what is next. But faster development also means the public needs better education. Not every exciting headline means a drug is approved. Not every trial result means the medicine is available. Not every new breakthrough is safe for everyone. Science moves step by step. A study is not the same as a prescription. A press release is not the same as long-term real-world safety. So when you hear about the next powerful weight loss drug, pause before believing the hype. Ask whether it was studied in humans, how many people were included, how long they were followed, what side effects were seen, whether it is FDA approved, who it is approved for, and what the long-term data show. Those questions protect people from marketing. Now let's bring the discussion back to everyday life. Imagine someone who has struggled with weight for 20 years. They have tried diets. They have lost weight and regained it. They have high blood pressure. Their blood sugar is rising. Their knees hurt. They feel ashamed at the doctor's office. Then they start a medically supervised GLP-1 treatment. Their hunger reduces. They eat smaller portions. They walk more because their knees hurt less. Their blood sugar improves. Their blood pressure improves. They feel hopeful. That is a real and meaningful benefit. Now imagine another person. They do not have a medical need. They feel pressure to look thinner. They buy a cheap online version from an unknown seller. They inject something without proper evaluation. They become nauseated, dehydrated, and weak. They undereat. They lose muscle. They feel anxious around food. That is not health. Same category of medicine. Very different situation. This is why the message cannot be all hype or all fear. The truth is balanced. These medicines can help the right person. They can harm the wrong person or the right person using them in the wrong way. If someone is considering these medicines, the best next step is not to copy an influencer. The best next step is a real conversation with a qualified healthcare provider. That conversation should include medical eligibility, expected benefits, possible side effects, warning symptoms, nutrition monitoring, muscle protection, medication interactions, long-term planning, and how success will be measured beyond the scale. A trustworthy provider should welcome these questions. The goal is not to make someone smaller at any cost. The goal is to help someone become safer, stronger, and healthier over time. Lifestyle also deserves a better explanation. Some people hear lifestyle changes and feel blamed. But lifestyle is not punishment. Lifestyle is support. If the medicine reduces hunger, lifestyle builds health. Food provides nutrients. Movement preserves muscle. Sleep regulates hormones. Stress management reduces emotional eating. Medical follow-up catches problems early. Community support reduces isolation. The medicine may open the door, but daily patterns help people walk through it safely. For older adults, this is especially important. Excess weight can worsen diabetes, blood pressure, joint pain, sleep apnea, and heart risk. So weight loss may help. But older adults are also more vulnerable to muscle loss, bone loss, dehydration, dizziness, medication interactions, and frailty. That means the goal should never be rapid weight loss at any cost. The goal should be strength-preserving weight loss. For seniors, a strong body matters more than a small body. These drugs may affect more than medicine. They may affect the food industry. They may affect insurance debates. They may affect workplace health programs. They may affect how doctors are trained. They may affect how society talks about weight. And hopefully, they may reduce some of the shame around obesity. But they could also increase pressure to become thin. So the cultural message matters. The right message is not everyone should be smaller. The right message is people deserve safe, evidence-based, compassionate care. Now let's bring it all together. GLP-1 and related medicines became famous because they target real biological pathways involved in hunger, fullness, digestion, and blood sugar. For the right patient, they can reduce appetite, quiet food noise, support meaningful weight loss, and improve health markers. They have changed the medical conversation around obesity. They have helped many people feel that their struggle was not simply a failure of discipline, but they also come with side effects. Nausea, vomiting, diarrhea, constipation, reflux, stomach pain and fatigue can happen. More serious risks, while less common, must be taken seriously. Long-term treatment planning matters. Stopping can lead to weight regain. Nutrition and muscle protection matter. Mental health matters. Medical supervision matters. And unapproved online products can be dangerous. So the most honest conclusion is this. These medicines are not miracles. They are not shortcuts for everyone. They are not cosmetic toys. They are not something to buy casually online. They are powerful medical tools. And when powerful tools are used correctly, they can change lives. When used carelessly, they can cause harm. The real story of America's weight loss drug boom is not just about thinner bodies. It is about a shift in how we understand obesity. Away from blame, toward biology. Away from shame, toward treatment. Away from quick fixes, toward long-term health. And that may be the most important breakthrough of all, because the future of weight care should not be built on judgment. It should be built on science, safety, compassion, and honest medical guidance. So before believing the hype, remember this. A healthy body is not created by one viral drug name. It is built through the right care, the right information, the right habits, and the right support. For some people, these medicines may be one part of that journey. Not the whole journey, not the only answer, but one powerful tool in a much bigger story of health.